Hi everyone, happy Friday. It's Friday, right?
It is. Finally.
This week, y'all, has been a week. Let's just say that. I am so excited to be here. I started something a month ago called Life of Mom's Expert Series because y'all know I'm not an expert, but I have amazingly talented friends who are in certain fields that I really feel that could help our community, us moms, be the best version of ourselves. So this month, September, our expert series expert is Dr. Aimee Ostick.
Hi.
You can check her Facebook page out at Ostick MD. Hold on, I have a little graphic for you. So I just wanted to kind of, we're moms. Amy's a mom of 3. I'm a mom. We have crazy lives, and I think it's really easy for us to put everyone else's health specifically before our own. And I think sometimes that can be a bit of a mistake because in order to be the best moms to our kids, sometimes we have to take care of ourselves so we can take care of our kids. So I am a big proponent of the self-care is not selfish because you have to take care of yourself. So I'd love for you to kind of give a quick background of your practice and how long you've been doing medicine and all of that good stuff.
Yeah, sure.
Okay.
So I'm a family medicine doctor, and a family medicine physician typically sees all age ranges. So I do pediatrics, all the way to geriatrics. I do a lot of women's health. So I do a lot of gynecology. I do women's health screening, so breast exams, and I do a lot of preventive medicine that way. And I agree. I think one of the biggest issues I see with women's health is that they see their OBGYN years long after their bearing years, I should say. And so there's a whole second half, as I tell them, that you're ignoring, and with cardiovascular disease and a lot of other cancer screening and preventative health that may or may not be getting addressed with your OBGYN. So a family medicine doc is a great person to plug into to make sure you're staying on top of your preventative health. I trained back east at Thomas Jefferson University. I am from the Los Angeles area originally. I've been around. I've worked at several different large academic centers, most recently at UCLA. And then this week, I just started my own practice.
Hashtag mom boss.
Yes.
Yeah, that's exciting.
Yes.
Like having your own practice with your name all over. You are the boss. I love it. So congratulations on that. That's So if you're local to LA, definitely check out Aimee at Ostick MD and come check out her practice. It's amazing. So we have some questions from our Life of Mom community. So I'd love to start with some questions, and then we'll kind of go into the 5 tips to maintaining a healthy lifestyle. And these are very easy, applicable things you can do in your everyday life on an annual basis to make sure you're being the best mom and person you can be for yourself, but also your family. So we have a question, so let's go. Hold on. It is a perimenopause question. Okay. So here is the question. Janine writes, perimenopause question. I'm in my late 40s and periods are going crazy. Cramps that I haven't experienced since teenage years. Sometimes a light period that lasts up to 2 weeks. Is this just par for the course? Should I give it time?
This is a great question. And, one that I think people, obviously women, deal with, and they may or may not know what's normal for them. And perimenopause is really kind of a phase of life that is identified or defined as being a couple of years before you stop menses, before you stop your periods, all the way until a year after, a couple of years after fully you're into menopause. So that's kind of it's a several year period of time that we'll be dealing with hormonal changes.
Right.
And this is I happen to have a graph. You don't know if you can see it, but basically
we can rule this over it, I'm pretty sure.
This is female reproductive system, and this one is just the hormone levels that happens with puberty, and then during kind of your 30s and 40s, and then perimenopause. Also, menopause is the age as far as when you go through menopause is very different, and pretty genetically determined. So if you want to get a sense, you can kind of ask your mom and the women in your life as to when they went into menopause. It typically anywhere between 45 and 55, but it could be on the later end for some people in your family. So you might get a sense that you might be following in their footsteps, maybe on the earlier end, maybe in the early to mid 40s. But as you get older, in general, your estrogen levels are falling. And what's happening there, real simply, is that your endometrial lining in your uterus is destabilizing. So it's sloughing off, right, more than it usually does. So you're getting typically heavier periods, and that causes cramp, that can also be associated with cramping and also spotting, so irregular periods. So this is very normal in that sense, and again, can be a very normal phenomenon for you, but specifically what I just want to tell you what to look out for. So when you should kind of check in with your doctor. If you are over the age of 35 and you have kind of a new onset heavy period, what they call menorrhagia. So Janine, if you're over the age of 35, for anyone out there, and all of a sudden your periods just get heavy and they have not been heavy in the past. Again, can be very normal, but you need to be seen to make sure it's not anything more serious like endometrial cancer. So, and that typically is determined either with an ultrasound and or what they call an endometrial biopsy. Some family doctors do that. I do those, but OBGYNs obviously can do those, which is an in-office procedure. And that's just to make sure. And then once that we've sort of determined, okay, it's nothing more serious, then we can talk about how to manage it. And we can get into another episode maybe down the line about hormone replacement therapy. But that's that's not something. That's one way that some women do that. And there's obviously some issues with that. But just knowing that it's nothing more serious is the first key. And then you can talk with your doctor about, okay, so now what do I expect? What should I do about this? How can I better manage it?
That's very, and I think I don't think I included this, but she talked about, was it hormones?
Hormones, yeah. Mm-hmm.
Yeah, but that she should first get seen before I talk about any of that stuff.
Absolutely, and the big danger is if you don't get that ruled out, and let's say you do go to a naturopath or somebody that gives you hormones, and you do have an underlying endometrial cancer, now you're feeding that cancer with hormones. So you really want to rule that out before anything. And then you can have a risk-benefit talk with your doctor about hormones if it's appropriate, determining your other issues. So
Okay, good question. Thank you, Janine.
Thank you.
Our next question from our Life of Mom community, and I feel like this feeds into our top 10 tips to maintaining a healthy lifestyle. So we're going to kind of talk about this, or I'm going to put this question up, and then we'll kind of lead into our top tips. So Susie D asks, how often is it often or often?
Depends on where you're from. What does the south side of Chicago people say?
I don't know. I was trying to be like over articulate and sound smart.
Do they?
Okay, no. Okay. Susie says, how often should we do self-breast exams? When should we start doing them? And can I just say, I'm so bad at this.
Yeah.
And my sister was diagnosed with stage 1 breast cancer at 41.
Yeah.
And I'm 39. So I should be doing this. And because of that, I get annual mammograms, even though I'm under the age, but I qualified because of my sister. But my sister was able to stop the breast cancer so early because of a self-breast exam. And I find myself starting to do it and stopping because I'm afraid, what if I find something and I'm not mentally prepared? I know it sounds so bad, but I think there's a real fear from moms, especially with kids. Like you don't even want to entertain the thought, so you put it off.
Absolutely.
You live in this state of denial, and I am very guilty of that. So
absolutely.
We're gonna go into these 5 tips, but first, how often should you do self-breast?
This is a great question, and I agree with that. Just to piggyback on that, we all have a very personal individual experience with somebody, with a friend or family member going through breast cancer, I think it's a real trigger for women because they're so scared. They all have that story and how it was found, you know, and how. So what does that mean for me? So let's just talk about guidelines. And there, you know, about 10 years ago, there was some controversy about if we should even be doing that. And CNN probably went up there and said, you shouldn't even be doing that. They haven't been shown to be effective. So self-breast exams, there's self-breast exams, there's clinician breast exams of the doctor doing them, and then there's the mammogram part. Self-breast exams, I think I think we should be teaching our teenage daughters just to be comfortable.
Just to be familiar with your boobs.
Yep. Once a month, same time of the month. So if it's easy to remember, like on your period, just when you're on your period. So that's because typically that's the same level of hormones every month, right? So you're going to have breast tissue that's hormonally responsive and active, so it's going to get bigger and smaller and bigger and smaller. And so if you just do it the same time each month in the shower with your hand up and it like with two fingers, right, all the way around all the way moving, so counterclockwise, all the way into the nipple, and then don't forget your tail extends up here and the axilla, and switch over every month. Once, you know, at the same time every month, ideally. And then mammograms, we can get into typically around the age of 40 is when you want to start, unless you have family history or any other.
And then you start earlier.
Mm-hmm.
Okay, so before we go on to our 5 tips, we do have a question. So
okay, cool.
A postpartum question. Is there safe time for intercourse if the period is regular after giving birth?
So is there a safe time for intercourse?
Basically, can I have sex if I have a super regular period after giving birth without possibly getting pregnant?
Is the question pregnancy?
Safe time, yeah.
So typically what recommendation is, no intercourse for 6 weeks after, because that's more on the trauma to the area and everything else. So 6 weeks after, if your period is regular, if you're not using some form of birth control or contraceptive, you obviously have the risk of getting pregnant. I think that if the worst of getting pregnant, is there a safe time? It's usually right after your period. If you want to do it on the kind of, withdrawal method or the natural family planning method, it will be right after your period, right?
Right. When are you usually most
mid-ovulatory, right? So it's like 2 weeks after your period is when your estrogen progesterone levels spike, you release the egg, and that's when you're most fertile. So if you want to time it, you could try, but there's no guarantees, right? Everybody's different, and you can have an early release of an egg and not know it. So, that's. But I think if you're talking about the risk of pregnancy right after the period's done,
it's lower, but pull and pray is always an option. My sister did many of those. Okay. So good luck, Labani. I hope everything works out. And congratulations on having a baby. If you're postpartum, that means you've had a baby, and way to go for that. I hope everything is going great. So we're going to move into top 10 tips to maintaining healthy lifestyle. Here, come close.
Oh yeah, sure.
Because it looks like we're really uncomfortably close, but it films better on here. And when Aimee and I, Dr. Ostick, when Dr. Ostick and I kind of got together to be like, what do we want to talk about on here? And my whole feeling was self-care is not selfish, and moms need to take care of themselves physically, mentally, emotionally, all that, so that they can be the best versions of themselves for their kids. Mm-hmm. So we talked about tips in maintaining a healthy lifestyle. Now, Dr. Ostick is a primary care doctor, so she's going to kind of cover what you should be doing on an annual basis, daily, weekly basis in some cases, to make sure you're taking care of you so you can be the best mom and wife and spouse and all the things too. And for yourself. Just take care of yourself for you too. It's okay to be selfish. Okay, so we're going to go into top 5 tips to maintaining a healthy lifestyle. Now, we just talked about breast exams, so I feel like that leads into the first tip.
The cancer screening. Yeah. So women are very familiar with sort of breast cancer screening, I think. And there's a few other ones that we need to cover. And this is where your annual visit comes into play with your primary care doctor it's all age related, but then there's also some individual risk. Maybe there's something specific about your family history that you may need to talk to your primary care doctor. We need to screen for this because I have a strong family history of colon cancer or whatnot.
Right.
So this is where your annual visit becomes really important. So Pap screening. So just to be clear, Paps only screen for cervical cancer. So Paps are not screening for uterine cancer. Paps are not screening for ovarian cancer. So I think that is something that people get worried about because there's been some changes in the frequency, meaning how often you get Paps. Right. And they go, well, wait a minute, I have a family history of ovarian cancer. Well, that's different. So cervical cancer.
Yeah. Oh, here we
the
go.
Cervix. Right, sorry, the cervix up here. Here's your vagina. It's just that first part of the uterus that's leading up. Then there's your endometrium, your uterus, there's your ovary. So we're just looking at this part. We're not looking at any of this. So the cervical cancer, which HPV is the leading cause of cervical cancer, right? It's a viral mediated cancer. After the age of 21, right? So that's once you're 21. It used to be 16, and once you're sexually active for 2 years, or it's just 21. Mm-hmm. And then it's every 3 years. Okay, so that's the cervical cancer. And then once you're 30, you get to skip to every 5 years, because what we start doing at age 30 is co-testing with HPV, which is a PCR, a viral DNA test.
Yes.
If you even have the virus. If you don't have the virus, then we don't need to do it every year or every 3 years. We can space it out to every 5 years. Right. Now, all that goes out the window if you have a history of HPV, history of it. So, but this is just screening. So, and again, that's just for PAPs, and that's just for cancer screening.
Do you get a PAP every year?
No.
No. But so at what point should you be getting a PAP every year? If at all.
It's every 3 years from 21 to 30, every 5 years from 30 to 65.
Oh, wow.
And unless it's an abnormality, unless you're following something. So those are the newest guidelines. And the reason is we have these new DNA tests that are much more specific and much more sensitive. So they tell us a lot more information than we used to be getting. We used to get, 10, 15, 20 years ago.
And is that like a blood draw?
No, it's with the PAP.
Oh,
so
okay.
You get the PAP, and they're scraping up cells, and they're looking under the microscope to look at the cells. Then at the age of 30, that same sample, they run through a DNA test, and it looks for HPV.
Great.
If it's negative, then you're kind of in the clear for 5 years.
Awesome. Very good. Okay, so PAP.
And then we got mammogram. So mammogram, there's different guidelines from different organizations, but really the American Cancer Society recommends at age 40, we start with mammograms. The reason why we don't do earlier is because our breast tissue is very dense, right?
I always get that at my mammograms. Yeah. They need like another screening, and I panic, and it's just because your breasts are dense, and I'm younger, right?
Yeah, you're young.
I'm almost 40 though.
So exactly, so that's why we wait, because there's a lot of false positives,
right?
So earlier on, your dense breast tissue, they come in. There's what we have found through the research is that 40 is when your breast tissue becomes a little more fatty, a little easier to read through the X-ray, the mammogram.
Yeah.
So 40, and the frequency really depends. Every 1 to 2 years, depending on the density. So if you have very dense breasts, and the radiologist says, I can't guarantee that I saw everything, basically, then I want you coming back every year. We'll do it every year. If as once you get to 50 and things become a little bit clearer, they might space you out to every 2.
Gotcha. Yeah. And if you have a family history like I did, where my sister was 41 and discovered she had breast cancer, so I think I've been getting annual breast exams since I want to say young, like 30, maybe around 30.
And just breast exams, and then mammos when? Mammos then too.
Yeah. Mm-hmm. My OB/GYN at the time, she had lost a sister to breast cancer, so I think she was very hypersensitive to making sure us patients have it together.
And there's all breast cancers are kind of created differently. So like postmenopausal breast cancer, if your mom got breast cancer at 65, 70, is sort of a different disease than a premenopausal breast cancer, a little bit more genetically related.
Yeah.
So that's probably why you have a little bit of a higher risk. Yeah.
Kat, we have not discussed endometriosis, but if you have a specific question, definitely write it in so we can ask Dr. Ostick. She's very informative and so helpful. So definitely specifically ask what exactly about endometriosis is your question. So,
sure.
Okay, so Pap mammo.
And then the next is colorectal cancer screening. So this is colon cancer screening. So 50 is the magic age for that. And 50, is when we should all be getting it. And there's different methods. So there's the colonoscopy, right? And then there's new fit testing that a stool kit that you can do annually that's as good at detecting, but it's like almost too sensitive. So it might be positive if you have a hemorrhoid or things like that. Then you're down the road to colonoscopy anyway.
Right.
This changes if you have a family history of colon cancer, then your primary care doctor might recommend an earlier screening depending on the age of the family member when they were diagnosed.
Okay.
So these are, so basically 50 years old, you should be thinking about that if you haven't already. And then there's new guidelines now on lung cancer screening. And this was really sort of under a lot of debate for many years because, you do a chest x-ray, you find something in there and we don't know what it is. We undergo a biopsy that's very high risk and maybe it's nothing. CT scan has radiation exposure. So what was the best way to approach this in terms of who's high risk for lung cancer, how to differentiate? So really the lung cancer screening guideline now that you should be asking your doctor about if you fit within that is age 55 to 80. So if you're on the older end and you have a greater than 30 pack year smoking. So 30 pack year means like you smoked for 30 years, pack a day. Oh, so it's a pack a day times the number of years. If you smoked, 2 packs a day for 15 years, then that's 30 pack year. So you should ask your doctor if you have any history of smoking. Do I qualify for a lung cancer screening? Am I high risk for that? Yeah. And if you do, you may need a CT of your chest.
Now, this is totally, I recently lost a nephew to just kind of a freak clotting in his lungs. And then since then, I have read a handful of articles about vaping with nicotine, but like super young kids. Exactly. And I'm like, he's not here to ask, but I'm like, did he vape? Was there some kind of connection? Because all of a sudden I'm reading these stories of these parents that were like, it happened kind of out of nowhere. And the risk of vaping and nicotine, I feel like that is going to amplify these lung screenings because it's happening a lot.
It's a new thing. And we don't know as a medical community, really these risks. I mean, we haven't studied vaping, we haven't done a randomized control trial on vaping and non-vapers, but it's probably coming, at least in some sort of observational study, looking at the risks. But what we do know is that there's a whole host of unregulated stuff in there. And we're inhaling it at high doses when you vape. And so there's definite lung injury happening. And there have been some acute lung injury incidents where your kids are intubated in the ICU from e-vaping, God knows what. So that's a huge education piece I give to my adolescent patients and tell them just stay far, far, far away. They think of it as it's a safer alternative to smoking.
Right. Specifically to nicotine, because here in California, I have a lot of friends that vape with marijuana, but I feel like, I don't know why, maybe but the vaping with nicotine seems to be more detrimental and damaging.
Yeah, the vaping with the nicotine is that there's a whole host of additives that, like formaldehyde, for instance, and a lot of other things that we're not aren't regulated. There's nobody making sure that they're not putting something really more toxic in there. And then the marijuana, I don't know what, I guess there's not I don't know.
Right. I don't know.
I don't know.
I have friends that smoke. I don't. Okay, Kat is saying getting an OB/GYN to take me serious enough to do the laparoscopy without recommending hormone therapy.
Endometriosis is a really tough diagnosis, and I really I feel for you that you're going through that, because it's associated with a lot of pain, as I'm sure you're very well aware, and it's hard to diagnose. So endometriosis is not really well seen on an ultrasound or a CAT scan. So it's oftentimes they'll do a laparoscopy first to diagnose, to look and see.
Right.
And so what I would recommend, I mean, I would really try to see an endometriosis specialist if you have one in your area, or look into asking your primary care doctor and say, I really would like to see somebody who sees a lot of this, because it can be misdiagnosed, and they might just think it's cramps or regular menstrual issues. So that might be the issue. I'm not sure, but I would definitely maybe look into that further.
She said she wants to bypass birth control meds,
right,
because she can't take hormones due to mood disorder.
Right.
Need the laparoscopic diagnosis, but don't want to be put off.
Right. I would definitely get a second opinion if you're not satisfied with that. It's always worthwhile, right? For sure. Especially if you're thinking about maybe doing a major surgery to get another opinion.
Find another doctor, see if they're a better fit. Okay. So tip 1, cancer screening guidelines. All right. Tip 2.
We've got sleep hygiene, because I know we're all so good at sleeping. And we just get so much, and our sleep debt is at a 0.
Yeah, moms sleep so well all the time.
Yeah.
We just get 8 hours of uninterrupted sleep all night, right?
And this gets worse with age, by the way.
Yeah.
So you compound that effect.
So tell us some tips and the importance of sleep.
Right. So sleep, lack of sleep. Lack of sleep isn't something like you get a bad night's sleep and then you reset the next day. There really is a legitimate medical sleep debt that you accrue over weeks, months, and that eventually has deleterious effects on your health. So we've seen, people that really don't get enough sleep can affect your cardiovascular health, can affect your risk for certain types of cancer. So sleep is huge. Obviously, mood as well, and cognitive function.
I am highly affected if I do not get enough sleep. Ask my children.
True.
And husband.
So here are some things to just, and I know these things sound maybe easier said than done.
Right.
But in my rule of thumb with any behavior change, it's like 80%. If you have a bad day, diet, nutrition, sleep, write it off, go try the next day. Don't give up. Be consistent. And this is really with everybody in the house, so this isn't just for you, it's for your kids.
Right.
It's everybody needs some sort of consistency and boundaries, and everybody benefits from that. Everybody should know in your house, all your kids, what bedtime is.
Right.
Like 8 o'clock is bedtime. So that's mommy's bedtime. So bedtime, so go to bed the same time each night. We'll get to your issues later. And get up at the same time each morning, even on the weekends.
Mm-hmm.
And that just kind of sets your circadian rhythm and your melatonin, and everything is it's not being abruptly shut off or disturbed. Make sure your bedroom is quiet, dark, relaxing, and at cool temperature. Mm-hmm. So like the cooler the better. Okay. Think hotel cool. Think 68. Fan going. Remove electronic devices. So no Facebook checking in your bed.
I am very bad at that. That's the worst thing, and that'll amp me up.
Mm-hmm. Your bed should be for sleeping and for sexing. That's what it should be. Sleeping and sexing.
You hear that, Tom? Yes. Okay. And we don't have TVs.
Okay.
I've never put a TV in my bedroom since we've gotten married.
You put the laptop on your lap.
And not even the laptop, but it's the phone.
It's the phone.
I lay with my body pillow and I got my little phone.
Yeah. And then what it does is that blue light actually is stimulative to your brain. So it is a physiological response to blue light. So it's not just what you're reading, the activation that way. There's something very different than reading a book in bed. Yeah. Which really, if you're having problems sleeping, you shouldn't be doing either. Right. You really should be having some sort of routine, reading, sitting up, and then getting really sleepy and then going to bed in your bed.
Yeah.
So there should, so really if that's an issue, your sleep hygiene, this is the word we're using, should be like once you're hitting in the bed, you are going to sleep.
Yeah.
Okay.
Great.
Avoid large meals, caffeine, alcohol before bedtime.
I know. I'm horrible.
All of those things.
But I also feel like I have anxiety, and so I don't usually have a struggle falling asleep. But if I'm having a hard week or something's at the forefront, I find myself waking up at 1 or 2 in the morning, being so like I have to go back to sleep and like saying Hail Marys and trying everything to get myself to relax. But because I'm trying so hard, I'm ending up sleeping for 2-3 more hours. But yeah, I am not good with many of these. I will say when I grab my smartphone in the morning and I don't want to get out of bed, the blue light activation like activates my brain to start to wake up easier.
And then you get your nap time.
Yes, I love a nap.
They do. I mean, they've done studies on people after having 1 or 2 glasses of wine, and their sleep quality is less. So even though it makes you sleepy, is like you know you're a tired mom, you have a glass of wine, and you're ready to knock it out. You actually get less quality of sleep. So that means like the amount of time you're in REM sleep, which is your rapid eye movement, which is your quality sleep, versus your stage 2, which is really deep sleep. So you will wake up feeling tired. Nothing. Even though you've been sleeping the whole time. So your stages of sleep are different. And exercise. So getting physical activity during the day really helps the sleep. Again, the sleep latency. Getting to sleep, staying asleep.
Right.
Okay. So yes, that's sleep.
We have a question from Brittany. Remember I was talking about my amazing VA?
Yeah.
Yes, Brittany, my girl.
Oh.
I was telling Aimee Dr. Ostick all about you, Brittany, and how amazing and what a lifesaver you've been. She says, what are the symptoms of hormone imbalance and when should you see the doctor? Anything you can do on your own.
Yeah.
And she's young. She's younger.
Yeah.
With young kids. So is there, especially like postpartum after, your kids are toddler age.
Yes. So when you're talking hormone imbalance, specifically, estrogen and progesterone, typically that decrease is happening right around perimenopause. Right. So the symptoms of that are usually related to withdrawal of those hormones from your body, meaning when those hormones start to leave, and it can be early. I mean, it depends, again, genetically when you are predetermined to start going to perimenopause. So it's a vasomotor, so it's hot flashes, it's insomnia, so it's lack of sleep, mood, increased depression, maybe anxiety as well. And there can be skin changes and hair texture changes and things like that happen around that. So that's typically, but we're talking the age range of perimenopause. If you're on, the younger side in your 30s, those symptoms, whatever, you can get a check for hormones, but it may or may not be related. It probably isn't. Maybe there's something else going on. So we're very important to see your doctor. The other hormone, though, is your thyroid hormone, right? Which is not related to age or perimenopause. So that's different. I
had hyperthyroid for several years, and it now switched. So I actually take hypothyroid medicine because I had an irregular, and I was crazy, and I didn't know what was going on and what was happening. Thyroid was checked, and it was hyper. Yeah. It was right after I lost my mom, and I was like borderline hyperthyroid storm. Like really bad. Like I was immensely underweight. My emotions were, and I just said, well, I lost my mom. So like I kind of propped it up to that. As soon as I got on thyroid medicine, it was like everything kind of leveled out. Yeah. And it was like, it was life changing. So definitely get your thyroid checked. That's a good one.
That's a screening test that's indicated. So like again, annual physical, we're typically doing that test.
Yeah, like blood work, right?
Exactly.
It's in your blood work when you get an annual physical. But yes, I have been there. Not everyone, but I have. We can talk. We'll talk, Britt. Okay, so tip 3.
Tip 3, so immunizations, obviously we all know about immunizations and with our kids, but we just sort of like this leaves our brain as adults. We just sort of forget that there are things out there, certain infectious diseases that you're still at risk for being an adult. And so these are just, maybe obvious or not, but a Tdap, so a tetanus, diphtheria, and pertussis, is indicated every 10 years. And even really with pregnancy now, the new indications is with every pregnancy. We've seen that it's hard for people to hold, so pertussis is whooping cough.
Okay.
And so this is different than just your regular old tetanus. Tetanus is like your TD.
And you're at a higher risk when you're pregnant, right?
Your pertussis or whooping cough is potentially lethal to a newborn. So what you want to do is you want to get boosted when you're pregnant to give that immunity to the baby.
Yeah.
Okay. And that you don't get it and pass it on. So
gotcha.
So that Tdap is very important to make sure you're on top of that. And then also, if you have a newborn, everybody around your newborn is caring for your newborn should have one of these as well. So ask all those people. So Tdap is specifically.
Tdap. Okay.
Flu shot every year. And now I know this is, a lot of people come in and they go, when I had the flu shot, I got the flu.
Right.
That's scientifically not possible. What happens is you get an immunological response and sort of like your immune system gets a little revved up because you got an immunization and you feel kind of achy. You feel achy, sore throaty, but it's not the flu per se. It's not influenza. Flu shot really reduces the risk of getting the flu. And it depends on the year. Last year was about 40 to 50%. And really reduces the morbidity affiliated associated with getting the flu. So pneumonias, getting hospitalized with sepsis and things like that. So definitely a flu shot every year. I recommend to everybody.
I just have to tell you guys, almost a year ago to the day, my best friend, who's also my cousin, her 2-year-old at the time got the flu. It turned into pneumonia, turned into collapsed lungs, it turned into 3.5 months in the ICU. He was airlifted to Children's Hospital in Chicago. It was very scary. And she is now like a huge, massive proponent. Get your flu shot.
Get your flu shot.
Go.
Right.
Because I think when we're healthy and we're going about our lives, it's really easy to be like, oh, everyone's fine. And then you get it and you realize just how.
Yeah. Have you gotten your flu shot this year?
I haven't.
Because I have one here. If I can I'll give it to you.
I should get it. I need to get my kids, especially my oldest.
Under 6. It's early, but yeah.
Yeah, because my oldest, she's got a sensitive immune system. So I feel like she gets everything a little bit worse. So if flu comes through the family, she gets it really bad.
More safeguards, right? This is herd immunity. Herd immunity is we all, as a community, need to get immunized and vaccinated, especially to the flu, because we act then as a defense from passing through us and going to the 2-year-old in the playground,
right?
Or to the 9-year-old in the grocery store, wherever, So it's really important to maintain that herd immunity. So getting your flu shot every year is very important.
It's very important.
Prevnar and Pneumovax, these are things that are that you may not think about. Typically, we recommend, obviously, in older folks to get a vaccine against pneumonia. But if you do have a history of asthma, so a history of childhood asthma, and as you're an adult now, diabetes, if you have a history, any sort of immune suppression, so if you're on any sort of medication that would suppress your immune system, history of smoking, you may be eligible or a candidate, rather, for a pneumonia shot. So also ask your primary care doctor about that.
Oh. Very good. Dad, did you hear that?
Oh, he's up to date.
Okay. Yes.
Mr. Van.
Yes.
Okay.
Okay, so tip for cardiovascular health.
Yes. So this is huge. We don't really think about this, especially with women. It's still a leading cause of death in women is heart attacks, MIs, cardiovascular disease, strokes. Huge. So we need to make sure we're preventing these events. And so maintaining the things that we know that are associated with cardiovascular health. So smoking. If you're smoking, stop it.
Just
today.
Stop it right now.
Smoking. 4 years medical school, residency, all that, I always, like, the one thing that I learned, the healthiest thing you could do for your body is to stop smoking.
Stop smoking.
It increases your risk of everything. So
Everything.
Cancer, heart attacks, everything. So, but annual cholesterol testing, so getting your cholesterol checked every year. You don't need to fast really anymore. Most of the labs do direct testing, so don't use that as an excuse to having not gotten it done, because that's it. Oh, that's a fast. Just go and
you
get
can
it done.
eat. Just go get
Just
it
go
done.
get it done. And then screening for diabetes, so making sure your blood sugars are all good.
Awesome.
Yes.
Okay, so fifth and final tip
Yes.
on maintaining a healthy lifestyle. So just like sleep, I get a big fat F for nutrition and sleep. I feel like I do my screens.
What's your weakness with nutrition?
I'm not a sweet tooth, but I love a salt. So I love a French fry. I love a chip. And like I just was reading your note, carbohydrate metabolism goes down as you get older. Because I feel like for so long, my whole diet was carbs. And I tried the keto diet for like 10 days and I didn't like it. So yes, I mean, but at least I'm aware of it.
Yes.
I'm self-aware. I
That's the
just
first
need
step.
to like, first step is getting past the denial.
Yeah.
So nutrition.
Yes. So our body does, as we get older, we don't metabolize those carbohydrates as efficiently. We throw carbs at our kids, and they're like running around the school. They burn it off instantly, literally the next second. And so what happens then is it gets stored. That carbohydrate, the excess carbohydrates get stored as fat or high cholesterol in the liver. And the other thing is what I think the reason why we failed, is because our food pyramid in the U.S., that bottom tier for so long was bread. It's like you need to have
changed.
Oh yeah. Oh no.
The food pyramid changed.
Oh yeah. It's all divided now, and there's different. Yes.
Oh.
Yes. So we just have this thing of like we need to have bread.
Fill. Right.
Grab a sandwich, bread roll, bread, pasta, big thing of pasta, a little bit of bolognese. Yeah. So Chicago style pizza.
No, I mean basically the Chicago diet: deep dish pizza, hot dogs, hamburgers, French fries, beef salmon. Oh gosh,
hot dogs with ketchup.
So my husband, yes. So my husband calls anytime we go to Chicago on a trip. He calls it the Chicago 10 because he gains 10 pounds every time we go because it's just we eat so unhealthy.
That's how it is in Philly. Philly, it's cheesesteaks and all that. So.
Yes.
That's where my husband's from. So he gained 7 pounds.
No, and they're tall, skinny men we are married to.
So switch over as you get older, and even now, like I think as you in your early 20s, 30s, certainly as you hit 40, higher protein meals. So focus on that protein. Focus on lean protein sources. If you're vegan or vegetarian, there's ways to do that as well. But higher protein meals, more frequent. So you should be eating like. Really, the best way to do this is every 2 to 3 hours be eating so you don't have this hanger. The hanger.
I wait. I skip breakfast, and then by 11, I'm a vulture. Yeah. I'm doing everything wrong. So if any of you are watching this and feeling not good about yourself, just know you're not alone. I need to apply the same many of these tips to my own lifestyle. So small meals.
More frequent, smaller portions. I mean, the portion size also. And there's a lot of ways to do this. There's zone diets, there's Atkins diets, but in general, what those have in common is higher protein, lower carbohydrates.
Right. Same with keto, right?
Keto is super high protein, and what it puts you in is to a state of ketosis. Right. So that you're fat burning.
Yeah.
The other one
that you can have like bacon. Or keto.
That's what ends up bacon and mayonnaise. Bacon and mayonnaise diet.
I mean, I didn't mind it for those 10 days, but then I was on vacation and they were frosés, and I'm like, I don't want to. And then all of a sudden, I started adding breaded chicken wings, and then it was just
frosés started.
That. I need to have that 80% mentality.
Yeah.
Like when I have a weekday. And then being able to like start fresh.
Exactly.
Yeah.
You forgive yourself.
Yes.
This is with diet and nutrition. You have to have a healthy practice of forgiveness. Like you're going to mess up. Yeah. It is okay. Just do better the next time. Yep. Don't slide downhill, because it's a lifelong thing. It's not a diet. It's not a crash diet. It's a lifelong thing. There's a lot of buzz about intermittent fasting. So I got a lot of questions about intermittent fasting. There's a lot of different ways to do that. There's a 16-8, which is fasting for 16 hours, eating for just 8. So you basically
I could do that.
Yeah. It's actually what you're probably doing, which is eating only from 12 p.m. to 8 p.m.
Yeah.
So you don't eat breakfast.
I would do that, but then it's like after a glass of wine, I have a bag of potato chips at 10 p.m. If I took out those chips, then I could be like intermittent.
You could be intermittent.
Yeah.
Intermittent. And there's been a lot of studies and associations looking at certainly weight loss, lipid metabolism, so improving lipid profile, intermittent fasting. But just the caveat here is checking with your physician, making sure that you're not on a certain medication that you need to be eating with, or there's not a contraindication. Obviously, if you have diabetes, then we need to be careful of that. So always check with your doctor before you do any sort of diet or sort of trial period, anything. Yeah.
Awesome. Seafood diet. Yes, Kat. I see the food, and that is my diet. So those are the 5 tips to maintaining a healthy lifestyle that Aimee was so, I keep calling you Aimee.
Okay.
Dr. Ostick. We've been friends for a long time.
We were friends before.
Yes. Dr. Ostick and I, she was so kind to come on here and provide these amazing tips. And thank you guys so much for watching, for interacting, asking your questions. I hope to have you back.
Yeah.
For another expert series, maybe in the spring or something, where we can because I think we need to just hammer in to you moms that the importance, it's so important to have that, to take care of yourself so you can ultimately be in the best care take care of yourself so you can take care of your kids in your best mind, body, and self. So, thank you. Go check out Aimee at Ostick MD. Thank you so much for being on here. And thanks so much for watching, you guys. Bye.
Bye.